G'day, I'm Martin Laverty, coming to you from Parliament House on the morning after the delivery of the federal budget. Most of the focus in the lead up to this budget was the announcement of a co-payment to visit general practice. Well, last night it was revealed there will be a $7 co-payment to see a doctor, to receive a pathology test or to have diagnostic imaging. But there's actually something that hasn't received the attention that it warrants, and that's a $2 billion reduction in Commonwealth funding to states to enable public hospitals to deliver their services over the next 4 years. Now, the federal government has announced it's reviewing the federation. It's also going to review the tax system, so that if we change the federation and the tax system in years ahead, state governments should have more resources to be able to pay for public hospitals. But what the federal government has announced last night is that in the next financial year there will be a $200 million cut in federal funds to public hospitals. Now, around Australia, it's state governments and Catholic health organisations that operate public hospitals. It's impossible to say right now what these changes will actually mean. We don't know if there will be service cuts. What we know is that we're going to have to work very hard on ensuring that changes to the federation, changes to the tax system, mean that there is enough funding within the nation's public hospitals to deliver services that patients need. More broadly, last night we also saw the federal government resolve a long-running argument on the aged care workforce compact. In 2012, the then federal government announced the workforce compact would see $1.2 billion flow to aged care organisations that adopted a certain set of industrial conditions. Catholic Health Australia argued against that in 2012, and last night, pleasingly, the federal government has redirected that money into the aged care subsidy with a 2.4% increase to residential and community care over the next few years. There's a lot to think about following last night's release of the federal budget, and the most important priority for Catholic Health Australia in the years ahead is going to see how we can ensure there are sufficient resources to fund public hospital services nationally for those that need them. Changing the federation, changing the tax system is hard work. But for Catholic Health, we're going to need to consider where we fit in this national reform agenda.